Hello and welcome. You're watching Health and Wellness. Save a life. Problems with the heart affect the entire body. No wonder then that heart disease is such an important public health issue. Heart disease is the leading cause of death worldwide, claiming an estimated 17.9 million lives each year. Up to 50% of all cardiac deaths due to cardiovascular disease occur in people who have no history or symptom of heart disease. Cardiac emergencies can occur at any time and at any age, and sudden cardiac arrest and heart attack are such emergencies. Now, it's been proven that bystander CPR improves the rate of survival by almost 50%. It is even more important if you have a loved one who has a history of cardiac disease. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We're joined by Dr. Balram Yadav, interventional cardiologist, Marble City Hospital, Kishangarh, Dr. Sarita Rao, senior interventional cardiologist, Apollo Hospital, and Dr. R.H. Sundar, Director, Cardiac Cath Lab, Consultant, Interventional Cardiology, Madras Heart Center, Chennai. Thank you so much, doctors, for joining us on the program. First to you, Dr. Rao, a family history of heart disease is a major risk factor for heart disease. Can you prevent heart disease if it runs in your family?
So yes, a family history of heart disease is considered to be extremely important. For example, if your father, your brother, your sister has had heart disease, it's possible that you may also have it because it is a genetically transmitted disease. But the important thing is that if you can change your lifestyle, if you can take appropriate lifestyle measures, for example, eat healthy foods, exercise daily, watch your weights, watch your numbers, that is your cholesterol level, the level of your blood pressure, the level of your sugars. If you watch all of these things very carefully, then the chances are that you can reduce the incidence of heart disease. So you can actually prevent it by taking appropriate lifestyle changes, and that's very important to do.
Dr. Sundar, many different tests are used to diagnose heart disease. What are common tests used in diagnosing blood vessel blockage and heart disease?
To start with, any physician has to have a proper history of the patient and a thorough physical examination. And one of the most simplest, easily available, most economical investigation is an electrocardiogram or the ECG. And the more important thing beyond getting an ECG done is to interpret the ECG immediately. So the physician or the cardiologist should interpret the ECG, and based on the background history of the patient, physical examination, most of the times we arrive at a diagnosis with an ECG itself. If the ECG shows some variation with the history in mind, then the doctor may advise a combination of tests. One would be a troponin, which is a blood test to see whether there is a damage in the heart, along with an echocardiogram, which is used to assess the muscle function and the valve function of the heart. So with these three important tests, namely combination of ECG, echocardiogram, and a troponin test with a background of a good history and physical examination, 90% of heart disease can easily be identified. And based on these things, if the incidence or the chances of risks of heart disease is much lower, the patient can be sent home. If it is on the intermediate or the higher range, the further investigations like a stress test or a treadmill, and if at all there is a need for an angiogram to identify blocks, that can also be ordered based on the investigations with these basic tests. So these are the various tests which needs to be done to identify heart disease in anybody.
The term heart disease refers to several types of heart conditions, and what are those conditions?
See, heart disease is the term broadly used. It is not a single entity. It contains various types of disorders which are related to heart. First and most common is the coronary artery disease, which is the most leading cause of death in our country. And coronary artery disease is nothing but it is the blockage of the coronary arteries which are supplying the heart muscles, the myocardium. The block start with the deposition of the cholesterol in the inner part of the artery, which in initial state it is called as atherosclerosis, atherosclerotic plaque, which over the period of time will increase in the volume, and over the period of time the arteries will shrink and there will be stenosis in the arteries. And when the shrinkage is reaches around 70 to 80%, then patient may have symptoms of angina on exertion, And when the shrinkage is reached around 90 to 100%, then patient may have acute coronary syndrome or myocardial infarction, which in common term you used to say at heart attack. So this is the one entity. The other entity is the problems related to heart. The wall, there are 4 types of wall in our heart, 2 in the left side, 2 in the right side. The problems come in the 2 form. Either shrinkage of the wall, that is called stenosis, and the leakage of the wall, that's called regurgitation of the wall. So in both the conditions, patient may have milder form or the severe form. In milder form, patient does not have that much symptoms, but in the severe form, patient may have symptoms of shortness of breath, palpitation, giddiness, or angina-like symptoms. So this is the other entity. The third entity is related to the rhythm disorder, in which in our heart there is a conduction system which control regulate for the proper function of the heart. But if there is a problem in the rhythm generation, the conduction, and there will be an abnormal formation of circuit within the heart. In these situations, patient may have developed arrhythmia. The arrhythmia could be 2 types, either bradyarrhythmia or the tachyarrhythmias. In bradyarrhythmias, patient's heart rate goes very slow. Sometimes it may go beyond less than 20 or 30. Patient may go into complete heart block, and that could be the lethal condition. In tachyarrhythmias, patient heart rate goes beyond 200 or 300, or the severe form of the tachyarrhythmias are the ventricular tachycardia or the ventricular fibrillation, and these both conditions can be fatal. So the other entity is the heart failure, in which patient's heart become very weak and inefficient to pump the blood which body requires, or it may be in the acute or in the chronic form. So the other entity is the problem related to heart myocardium, that is a muscle of the heart, in which the 3 major conditions like dilated cardiomyopathy, in which patient's heart muscle become weak and very dilated, and very the ejection fraction will become very poor. The other entity is the restrictive cardiomyopathy, in which the relaxation problem of the heart become very weak, and patient may end up into heart failure. Other than that, the other entities is related to the infection of the heart. It may involve the wall of the heart or the endocardium. That's called an infective endocarditis.
Right.
And last one is the problem related to the pericardium. That is collection of fluid between the outer and the inner layer of the heart. Yes.
All right. Dr. Rao, what should you do if you think you're having angina for the first time? If someone has been diagnosed with angina, does this then increase the risk of a heart attack?
So absolutely. If you've been diagnosed with an angina, then yes, the chances are that you can have a heart attack. Now, if you've been diagnosed with angina, or if you think that you're having symptoms of angina, it's very important to visit whoever is your cardiologist, go in for an ECG, go in for an echocardiography to see if there's been any damage to the heart as yet. The third thing is to go for a treadmill test and see how positive is it. So if your treadmill test is positive, or if you have LV dysfunction, you will be subjected to a test which is called an angiogram, right? And it's very important to find out what is the status of the coronary arteries on the angiogram. If you have significant stenosis, if you have it in a proximal artery or in an artery which is supplying a very large area of the myocardium, then you need to get treated for it. So every angina is not benign. It needs to be looked at, evaluated, whether it's significant, whether it's going to lead to a heart attack in that patient. So they should get the requisite tests done, the ECG, the echo, the treadmill, and if the coronary angiography is required. And if there is a significant stenosis which threatens the life of the patient, then appropriate treatment for it should be done. Now we have 3 things for it. One is either a drug therapy, the second is an angioplasty, and the third is a bypass surgery. So whatever is required is decided on the basis of the angiogram for the patient. So yes, if you have angina, you need further evaluation, absolutely.
All right, and staying with the issue of angina, Dr. Sundar, is it true that there is more than one kind of angina? If you could explain to us, what are those types?
Yeah, absolutely. There are different kinds of angina. One variety is called a stable angina. As the name indicates, it's a very stable variant, which means the patient or the person, when he is at rest, he or she is at rest, they are comfortable, But when they are made to walk or climb a flight of stairs, or when they hurry up, then they may feel chest discomfort, arm discomfort, jaw discomfort, which means they have stable effort angina. And this could go on for years, which means there could be a 70 to 90% blockage in one of the major arteries of the heart, because less than 70% blockage generally doesn't produce symptoms. It is between 70 to 90 the person develops these types of stable angina, where the person may go on for years with a angina which comes on effort and which relieves at taking rest. This is because heart is a supply demand organ. At rest, the supply to the muscle is normal, whereas on exertion, the demand or the supply is not able to meet the demand. This could be managed by medicines, sometimes with higher end therapy, like what Dr. Rao mentioned, angiography, angioplasty, bypass. The other extreme variant of angina is an unstable angina, which, as the name implies, is an unstable variant, where somebody could be having chest discomfort on walking half kilometer for years together, but all of a sudden, for the last prior 2 weeks or 3 weeks, they could be having angina, chest discomfort on walking only 50 meters, or even maybe at rest, which means it means that the blockage is narrowing further than more than 90%, maybe 95%, which makes it unstable. That is the time when they have to immediately call for medical help, and that is the time they may need further evaluation and further intervention like an angioplasty or a bypass surgery, which is an unstable angina. The third variant is an more extreme variant, which is a heart attack where the artery is totally blocked, 100% blocked. So first we had 70 to 90, then you had more than 90, say 95, which is unstable angina. The third is a frank, full-blown heart attack, where all of a sudden the blood vessel become 100% blocked, where there is no blood supply to the muscle, chest pain is severe, sweating occurs, vomiting occurs, shortness of breath occurs, where the patient needs to be treated on an emergency basis immediately. So these are the various types of angina: stable one, unstable one, and a full-blown frank heart attack. These are the various types of angina, and each type of angina needs different type of treatment.
All right, with that, we'll slip into a short break, but don't go anywhere. We have a lot more questions lined up for our doctors. Do stay with us. Welcome back. We're watching Health and Wellness, Save a Life, and we're talking about heart health, also angina pain. Now let's go across to our doctor. Dr. Yadav, are there any triggers for angina, and if yes, what are those triggers?
See, there are conditions in which patient may have angina, like strenuous physical activity. Patients are doing exercise in the gym, is climbing, running fast, and conditions like extreme cold or extreme hot after taking heavy meal, or any time where the patient having emotional stress. In those conditions, patient may have typical angina, because in these conditions the patient's heart will work more and faster, for which he demands more amount of blood supply, glucose or the other nutrients. But in patients in blocked coronary arteries, there will be insufficient or inadequate or fixed amount of the blood which circulate to the heart myocardium. So there will be demand and supply mismatch. Because of this, the patient may have developed angina.
All right, Dr. Rao, during cardiac arrest, what happens to a person? If you can explain to our viewers, what is a cardiac arrest?
So, when we talk about cardiac arrest, now cardiac arrest is a situation in which, there is a sudden unexpected cessation of the function of the heart. Now, what exactly is the function of the heart? The function of the heart basically is to pump blood to the rest of the body. Now, if for whatever reason, it could be a heart attack, it could be a sudden ventricular tachycardia, an arrhythmic event, it could be a heart block, it could be any reason as such for which the heart has suddenly stopped pumping. Now, if that happens, the patient has a cardiac arrest. And what happens at this time is that the blood pressure drops, the heart rate drops, the blood pressure drops, the patient goes into a sudden asystole kind of a situation. So basically, you need to immediately take some emergency measures. You need to immediately start CPR of the patient, because a sudden cardiac arrest has a very high mortality if you do not do anything for this patient. For example, if you have an out of hospital cardiac arrest, 60% of these patients do not survive. But if somebody does a CPR, if somebody performs a resuscitation on this patient, there's a bystander who does a CPR activity, then the chances of survival become much higher. So a sudden cessation in the pumping of the heart, causing the blood pressure, the heart rate to drop to zero, that is a cardiac arrest situation, which can occur in many kinds of etiologies. But yes, you need to do a CPR immediately to resuscitate this patient, or he's not going to make it. For every 1 minute that we delay in doing CPR, the chances of survival drop by about 10%. So in 10 minutes, the story is over. So you need to really immediately start resuscitative measures to revive this patient.
All right. Dr. Sundar, what steps should a bystander follow if he or she recognizes that someone is having a cardiac arrest?
Yeah, this is a very, very important question. And actually, this program is meant to send a message across to millions of people who are watching this, the value of a bystander CPR, because you can't expect a trained medical person to be available by the side of an emergency when it is happening, say, in your house, in your work spot, or in a gym, or so on and so forth. Because these cardiac arrests, as was explained before, happens when you least expect it, in a person also where you least expect it, maybe in a 40-year-old very healthy gentleman. So first and foremost is never panic. And when will you not panic? You will not panic if you know CPR. In today's world, we learn so many things. We know to handle complicated gadgets, cell phones, etc., etc. So learning a CPR is nothing more difficult. It's much, much easier than handling a very complex gadget. So we need to, each and every one should learn how to perform a bystander CPR, number one. So if you see someone having a cardiac arrest, the first important step, not to panic, begin a bystander CPR immediately, because that is what is going to keep that person alive till help comes. And second is, the person who is next to that person who is giving the bystander CPR should immediately alert the ambulance. And for that, you need to have each and every household, work spot, airport, or any grocery store, or whatever, or even a mall, should have the numbers of the emergency person, ambulance numbers, which is next to them, closest ambulance service, which could come immediately, which could take them to a emergency cardiac facility, readily available, because you can't be searching for that during an emergency. So everybody should have that number. So one person starts the CPR immediately, and that CPR can't be going on forever, because it has to be supplemented by a medical team which has to arrive on time. So it is a very, very coordinated process, and it should be begun immediately without any delay. So never panic, start a bystander CPR immediately, call for an ambulance immediately, so that you keep the patient alive till the ambulance comes, and then the following treatment they will be taking care. So these are the important steps which has to be done to save a patient's life. And as was explained before, it could be even a near and dear one whose life you would be saving that day, and that is really going to benefit he or she in the long run.
All right. And Dr. Yadav, how important is it to manage hypertension to reduce the risk of heart disease? What advice would you share for better management of hypertension?
See, hypertension is the major risk factor for the heart disease. It may cause coronary artery disease, it may cause arrhythmias, heart failure, or the hypertensive cardiomyopathy. Hypertension is not only problematic for the heart disease, but is also involved brain and kidney. In brain, it may be the major risk factor for the stroke, and the kidney is the major risk factor for the chronic renal failure. So to prevent the complication of hypertension, BP has to be managed. And how can we manage the BP? There are two ways, the combined way of non-pharmacological and the pharmacological intervention. So in non-pharmacological intervention, we have to do the diet and the lifestyle modification. In diet, we have to follow the DASH diet, in which there will be lesser amount of salt, and there will be more amount of green leafy vegetable, fruits, nuts, then your fish, and lesser amount of saturated fatty acid, and it should contain more amount of unsaturated fatty acid and lesser amount of sweety food. So this is the diet plan we have to follow. Other than that, we have to do lifestyle modification, in which every person of raised BP has to do moderate type of exercise, which may include the brisk walking, running, climbing, or swimming, etc. Other than that, if patient having obese and overweight, then they have to reduce their weight and bring their BMI within the normal range. If patients are taking alcohol or smoking, then they have to stop both of them, because these both are responsible for not only the hypertension but also for the coronary artery disease, or the other system involvement is also there with this two risk factor. And if patient having stress of
All right. Thank you so much, doctors, for joining us on the show and talking about this very important issue of heart health and also a bystander response. Thanks all for watching at home. Goodbye.